Welcome to Science Hub. Today, we're diving into an innovative approach in the world of psychotherapy that's making waves in the treatment of psychosis. This new technique focuses on transforming mental images to help patients manage distressing thoughts and emotions. Known as iMAPS, this mental imagery therapy is specifically designed to tackle the intrusive images that often plague individuals with psychosis. Unlike traditional methods, iMAPS directly targets these mental pictures to replace negative and threatening beliefs with positive ones. The technique involves understanding, transforming, and reframing these images, allowing patients to deal more effectively with their negative emotions. Research indicates that a staggering 74% of those suffering from psychosis experience intrusive mental images, which exacerbate paranoia and hallucinations. These images are significant contributors to the persistence of adverse psychological experiences. Traditional therapies, like cognitive behavioral therapy, have shown limited success in addressing these issues. Moreover, antipsychotic medications can lead to substantial side effects, causing many to discontinue their use. A recent clinical trial conducted by researchers at the University of Sheffield involved 45 patients experiencing psychosis and hallucinations. The results were promising, showing that iMAPS is both safe and effective. Patients actively participated in therapy sessions and noticed tangible improvements in their symptoms. Leading this trial was Drive. Christopher Taylor, who explained that the goal of the therapy is to help patients understand and control troubling mental images through various techniques, such as altering image characteristics and reframing negative events. One of the study's participants, Tom Brandow Spencer, began experiencing psychological symptoms at the age of 9. Thanks to iMAPS, he was able to understand and change the narrative surrounding the distressing images, regaining control over his life. Following the therapy, Tom completed his university studies in psychology and began sharing his experiences at international conferences, highlighting the positive impact of iMAPS. This method represents a hopeful new direction in psychotherapy for psychosis, providing a safe and effective alternative to traditional treatments. Encouraged by the positive results of the initial clinical trial, researchers aim to conduct broader trials to further evaluate the therapy's efficacy, opening new possibilities for patients to manage their symptoms and enhance their quality of life. Thank you for watching Science Hub. If you enjoyed learning about this innovative therapy, make sure to subscribe for more fascinating science content.